So you're ready to take your skincare up a level with in-office laser treatments, but with so many out there, where do you even start? I'm gonna break it down for you. I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California, and I'm here to help you understand your skin and find products and procedures that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. The next concern I want to move on to is textural irregularities in the skin. And texture can really be such a range in terms of the severity and what specific things bother you. It might be as simple as enlarged pores, it could be fine wrinkles, deeper wrinkles, and then acne scars. And which laser you do or which laser is recommended to you is really going to depend on what textural irregularity you are experiencing, as well as your budget and your downtime. If you have irregular texture in the skin, and we are going to be performing resurfacing, that's what we call it, there's kind of two main categories of lasers that we think about, and these are going to sound familiar. Fractionated non-ablative lasers and fractionated ablative lasers. So the same types of lasers that I was talking about addressing pigment, because they hit water in the skin and they are not just chasing the melanin or the pigment, they are also really good at inducing collagen remodeling, so they can help with fine lines, texture, irregular pores, etc. One type of patient that will often come into my office is someone who is in their 20s, 30s, maybe their early 40s, and they are just starting to see the very earliest signs of skin aging. Slight prominence of their pores, very, very early fine lines. That is when I'm going to recommend what we call a prejuvenation laser. Something that's not too aggressive, something where there's minimal downtime and where the cost isn't too significant. The types of non-ablative fractionated lasers that tend to fall into this category are Clear and Brilliant laser, and another brand is Moxie. Like I mentioned earlier, Clear and Brilliant is the little sister of Fraxel. They are made by the same company, but Clear and Brilliant is just a lot more gentle, less powerful. You need more treatments to see results, but also the downtime and the cost is a lot less. So if you have someone who's just starting to see those signs of skin aging, or someone who isn't seeing those signs of aging but wants to prevent them from really ever showing up, that's where this type of laser really has a role. These lasers are targeting the very superficial aspects of the skin, so you can get some brightening and some very subtle lightening of pigment, and then there is a deeper setting on the Clear and Brilliant where you can get more pore refinement and some improvement in texture. But when I'm talking texture, I'm talking about the earliest of fine lines. I am not talking about treating acne scars, for example. And some of you may be wondering, well, can I do these prejuvenation lasers instead of doing something like Botox? And the reality is what Botox do and what lasers do are quite different. When you do these prejuvenation lasers, you are fortifying the skin, so it's going to be less prone to wrinkling and crinkling, so you might be able to stave off Botox a little bit. But if you're at the point where you're starting to see etched in lines in the forehead or in your scowl lines, that's not going to get a whole lot better from lasers, because you're going to continue to make those movements. They're not being prevented, and so you're going to keep etching in those lines. But combining some small Botox injections with a series of prejuvenation lasers can do wonders for the skin. That's really popular in my office. I treat a lot of younger patients who are really invested in optimizing their skin, and that combo is such a win. One thing I'll say is if you're dealing with a lot of pigmentation, even if you have very youthful skin, Clear and Brilliant is not very good at clearing up pigment, even though it's somewhat marketed to do so. However, if you do have melasma, Clear and Brilliant is a safe laser for you to get, and it can help temporarily with your melasma. And I think this is a point worth mentioning, because other lasers that are more aggressive, like a Fraxel laser, can actually flare somebody's melasma. So if I have a patient who's struggling with melasma pigmentation, and maybe we have them on a medical protocol, but they're also wondering what else they can do to improve their pigment, Clear and Brilliant is often what I recommend. Plus, they're going to get some additional anti-aging benefits as well. Now, in terms of cost of these prejuvenation lasers like Clear and Brilliant and Moxie, again, it's going to vary a little bit. It's usually going to range from somewhere between like $500 and probably about $800 per session. And sometimes when you buy them as a package or in a series, they will cost a little bit less. And the reason most of these are going to be performed in a series is because they are quite gentle. When I'm describing it to a patient and they're like, well, how many of these do I need? It's sort of like if you go and work out once, you're going to feel good about yourself, but you're not really going to see results. And kind of the same thing goes for these prejuvenation lasers. You usually need like 4 to 6 treatments to really go, okay, this was like worth my spend. And treatments are typically spaced 4 to 6 weeks apart for most people. These lasers are so popular in my practice and in other people's practices because they also have basically no downtime. For example, example, I can have a clear and brilliant laser done and then go out to dinner that night with a little bit of makeup on. So for my patients who have to show up in person for work or are busy moms, clear and brilliant is really popular because of that minimal downtime and conservative cost. And no, they are not going to have complete erasing of all their fine lines and wrinkles. Their pores won't become absolutely down to 0 pinpoints, but they will get improvements in their skin, and it's something that's easy to incorporate into their schedule and into their budget. So that's like early texture if you're being really picky about your skin. For example, like I do clear and brilliant on myself quarterly. When I do my Botox, I also do my clear and brilliant. Now, if you have deeper lines or wrinkles, a lot of dullness, that's where the fractionated non-ablative lasers and fractionated ablative lasers really come into play. So even though clear and brilliant lasers and Moxie lasers are technically fractionated non-ablative lasers, there are sort of like grown-up, more aggressive versions of these lasers like Fraxel Dual that can exert more powerful effects on the skin. So if you have more dullness, deeper etched in lines, that's where I'm gonna recommend something like a Fraxel. Yes, a Fraxel does have more downtime. So like I mentioned before, between 2 and 7 days of redness and some slight peeling, but you will get a lot more oomph per Fraxel treatment. Sometimes people are really nervous about the pain that they might experience with a Fraxel laser, and your pain control is so much up to who is treating you and what their protocol is. I'm very anti-pain. Like, I don't have a high pain tolerance. I don't expect my patients to. So we do lots of numbing. We offer laughing gas. And really the experience should not be something that you are absolutely dreading. And because these lasers are often done in a series, it's really important that your first laser experience is a comfortable one so that you can come back and get the rest of your treatment so you can get optimal results. Lots of the patients in my practice are getting a Fraxel laser not just to target fine lines and wrinkles, but also because they have irregular pigmentation. Because Fraxel has that dual setting. Usually the first couple treatments in their series, I'm going more superficial to bring out that pigment and get rid of it. And then their subsequent treatments, I'm going deeper to get their tissue to remodel and to smooth out some of those fine lines. And similar to the clear and brilliant lasers, Fraxel laser treatments are usually spaced somewhere between 4 and 6 weeks apart. That doesn't mean you can't space them out further, but we certainly wouldn't do them closer together than that. And I should also mention, during your downtime, you are not in pain. So yes, the procedure is uncomfortable. It feels hot, and for about 2 hours afterward, you're like, dang, like I feel like I probably have the worst sunburn of my life. But after that, you're quite comfortable. You just don't look very good. So I always tell patients, while you're healing from a Fraxel laser, you're going to look a lot worse than you feel. But now let's say someone doesn't want to do a series of Fraxel Dual treatments and they're like, I want the one and done, just hit me hard. That's where we're talking about fractionated ablative lasers. So that's going to be your CO2 lasers and your erbium lasers. CO2 lasers go a bit deeper. They're a bit more intense. Erbium lasers are a little bit more superficial, so you may need more treatments, but there's also less downtime. And I'll put some of the brand names of these lasers in the description box. There are so many different brands of these lasers, and sometimes when you're looking at different websites, you're like, I don't know what an Ultra Pulse is, or I don't know what a Deca does, so I'll put it in the description. But really what's important to get out of this is if you have deep etched in lines and wrinkles, the best chance you have to minimize, because most lasers are not going to be able to completely erase your lines and wrinkles. You want to do CO2 or an erbium. However, with great results come great responsibility. The downtime of a CO2 laser can be 1 to 2 weeks, and it's not just like casual downtime like you have with a Fraxel where it's a little bit of flaking and peeling. We are talking about bright red, raw skin. Usually within the first 48 hours of having a laser like this, you're having to clean your skin every 2 to 3 hours, and this includes in the middle of the night. Also, because you are vaporizing channels of skin, you have lots of raw skin exposed, and it puts you at a high risk for infection. So if you're having this type of treatment done, you are typically also placed on antiviral medication, oral antibiotics, and sometimes even antifungals. And aside from risks of this laser being things like infection, you also run the risk of hyper or hypopigmentation, and you also run the risk of something called prolonged erythema, where the skin is reactive or red for many, many months after the procedure. And these risks aren't that common, but they do happen, and it's really important to take lasers seriously. All over TikTok lately, I've been seeing like, oh, I just went and got my CO2 laser done. That is like a big deal procedure, okay? Like, I don't want you to be taking these things lightly, because if you're someone who has an unfavorable outcome, you will really feel that. And because these CO2 lasers and erbium lasers put you at higher risk for developing irregular pigmentation, if you're someone who has a deeper skin skin tone, that risk is even higher for you. Aside from having longer downtime and more risk, CO2 is generally a more expensive procedure. So like I mentioned before, maybe $2,500 in certain parts of the country, but certainly $5,000+ in a lot of parts. But despite the cost, despite the downtime, despite the risks of all of these lasers, patients continue to do them because they do see really meaningful results. And I know patients these days are really sensitive to looking weird or looking overdone. You will never look weird or overdone with a good laser treatment. You will just look refreshed and like the best version of yourself. And I have lots of patients who are like, listen, Dr. Ellis, for whatever reason, I'm never gonna do Botox, I'm not going to do fillers, but like hit me with all the lasers. And that's a perfectly reasonable approach. I think you have to temper your expectations a little bit, but you will never go wrong with making your skin healthier and look better. So I feel like that really sums it up when it comes to improving texture in the skin with lasers. I know I didn't talk about acne scars, and it's because I have a separate video all on acne scars where I dive deep into lasers for that, so check it out. So where we're at so far is with lasers, we can address pigmentation, we can address texture like fine lines, wrinkles, and exaggerated pore size. The other thing people often come in for laser treatments for is to address redness. Redness treatment is something that is very near and dear to my heart as someone who has rosacea and who has personally undergone numerous laser treatments to improve it. When we are treating redness with a laser, there are two very popular lasers that are used, pulsed dye lasers and KTP lasers. They have slightly different wavelengths, but both target hemoglobin in the skin. And hemoglobin is the protein that makes your red blood cells red. So when you have a laser that's targeting those specific cells, it's going to blast away any vessels that contain them. The brand name of pulsed dye laser that you may have heard of is called V-beam, and the most popular KTP laser is XLV. And I should have said this earlier in the video, but I think this is a nice place to make this point, is it is so much less about the specific brand of laser used and so much more about the person who is operating that laser or who is overseeing that treatment. I have a wonderful colleague who prefers her KTP laser. I prefer my pulsed dye laser. We can get the same results if given the same patient. We just are going to come at it with a slightly different technique because we're using different lasers to approach it. With any laser that is targeting redness in the skin, it's going to work the best if you have a visible superficial vessel. And I say this as a contrast to someone who just has flushing, but when you look up close at the skin, you don't see any specific dark red pigment. Because remember, lasers are targeting hemoglobin. They need to see that little tiny red blood cell in order to hit it. So if you just have kind of pink diffuse skin, the laser can't really figure out where to go. That being said, most people who have flushing do have some dilated blood vessels. So by going in and treating those dilated blood vessels, it will help with the flushing to some degree. With these lasers that target redness, whether that's red birthmarks or rosacea or just dilated blood vessels caused by sun damage, usually you're going to need several treatments to get the best results. For most of my patients who are coming in with redness of some kind on the face, whether that's just little dilated blood vessels or the redness associated with rosacea, I'm usually estimating somewhere between 2 and 4 treatments to start with. And most of these treatments we are going to be spacing 4 to 6 weeks apart. These lasers generally don't require topical numbing. They are kind of uncomfortable. Like I would describe it as like a cold, wet rubber band snap against the skin. And so with a few of those pulses, it's not so bad. If you're doing your entire face, by the end, you might be like, whew, dang, like I really went through it, but it's generally quite tolerable. In terms of side effects, bruising is probably the biggest potential side effect. If you hit a laser with a high force very quickly, it will bruise. That usually means you're going to get a great result, but you're going to have to deal with that bruise in the meantime. It's actually pretty rare that you need to bruise somebody to get them the results that they want, but there are certain vascular things that require bruising in order to get them to go away. The other thing people tend to experience besides bruising is swelling. Some people have very minimal swelling, and some people swell like I do, where I turn into like a full-on puffer fish for 5 days afterward. So I always warn my patients if they've never had a V-beam treatment to expect swelling, and then if they don't have swelling, they know for next time that they don't have to plan for as much downtime. And as with all of these lasers and all of these conditions, these lasers do not prevent your redness from coming back in the future. So it will treat your existing redness, but if you are a red person or you have ongoing rosacea, you are going to continue to make red blood vessels, and if those bother you, you will want additional treatments in the future. So for a lot of my rosacea patients, they maybe are doing an initial series to really calm down their redness, and then perhaps once a year, they're doing a single treatment to keep things in check. I know earlier I spoke about IPL and BBL for helping with pigmentation. Because IPL and BBL use multiple wavelengths of light, they also can be helpful with addressing redness in the skin. So that's another place where I will use an IPL or a BBL in my practice. If someone just has redness, I'll choose my V-beam. But if someone's coming in with brown spots and red spots, which is pretty common if you have sun damage, sometimes IPL is the right choice to start because you can kind of tackle both of those issues in a single treatment. And then sometimes I'll go in and finesse the treatment after they've done their series of IPL with my V-beam to get any remaining redness and my Pico Way to get any remaining brown spots. The cost of these redness lasers is going to vary based on how much surface area you have involved and how dense your vessels are. Probably ranges somewhere between like $250 to $1,000 a treatment. Because these lasers target all types of redness, if you have something called cherry angiomas, which are like little red spots that you can get anywhere on your body and tend to accumulate over your lifetime, these types of vascular lasers are really good at treating those as well, and you usually just need one treatment per spot. Sometimes my patients will come in and we'll do kind of like a full body treatment. We call it detailing, where we just go in and I take my Pico Way and we get the brown spots, I take my V-beam, we get the red spots, and then they can leave kind of fully refreshed. Another thing that's really important to note is if you're having a laser done to treat pigmentation and it's targeting melanin in the skin, so that's going to be that Q-switched Alex, Pico Way, or even an IPL, it's really important that you have as little of a tan as possible. The reason for this is these devices are targeting pigment in the skin, but they are not smart enough to know, oh, this is the pigment of the brown spot they don't want, or this is the pigment of their background skin. So you really want high contrast between the spot that's being targeted and what's in the background. So if I have a patient who comes in and they're super tan, I will not perform the treatment. Or even if they have a fake tan on, I won't perform the treatment because the laser can't tell the difference. So it's really important that you don't schedule your laser treatments right when you get back from vacation or within a couple weeks of having any fake tanner on. All right, I think I will end this video here for now. Lasers are a very broad topic, so I'm sure you still have additional questions. Please let me know if you have tried any of these lasers and what your results were. Let us know in the comments. People love reading the comments and learning from you guys in this community, so please share your experiences if you feel comfortable. Thank you so much for being here. Don't forget to give this video a thumbs up and make sure you're subscribed to the channel, and I'll see you next time.